Welcome back. Are you or someone you love struggling with chronic pain? Do you think you are out of options when it comes to stopping that pain? Well, here to tell us how Prolotherapy may be able to help is Dr. Ross Hauser. He is a prolotherapist at Caring Medical Center. Good morning. Welcome back once again. All right, so we're going to talk about an extremely common thing for athletes here in Southwest Florida, and when we're running, and it's called runner's knee. That's kind of what people refer to it as. It's got a more technical medical term to it. What is that?
Yeah, chondromalacia patella. Chondro is cartilage, patella is kneecap, malacia is damage. So it's just damage of the cartilage beneath the kneecap.
Which means it's painful.
yeah, it's painful, and the cartilage is wearing out. And usually the cartilage is wearing out, Carly, because the patella isn't tracking good on the femur bone, like it's tracking off.
I'd imagine that because we use our knees so much to do anything from, walking to standing to doing, that they get a lot of wear, and then especially when you start running on them, it can happen pretty quickly.
Yeah, most people don't realize you actually, each joint of your body, you move 1 million times every year.
Oh, geez.
Carly, and I'm not going to ask your age, but let's say you're 30 years old. That would mean that you moved your knee joint 30 million times.
Man.
So, and again, if it's not tracking correctly, the cartilage is going to wear out. So wearing out of the cartilage beneath the kneecap is called chondromalacia patella, and runners notorious.
Diagnosed?
Yeah, normally you do x-rays. I mean, you kind of can know you have it if you touch your knee and you move your knee and there's all kinds of grinding, clicking sounds, grinding and clicking sounds. So then, if you felt clicking right there, you probably have chondromalacia patella, and you should get prolotherapy.
Well, talk a little bit. We actually have an x-ray to show you. You can really see, because it is kind of, I kind of compared it to kind of a puzzle piece, essentially. If things aren't kind of lining up correctly, which again is probably a pretty common thing that people are dealing with.
No, exactly. So
on this graphic, that top one, you can kind of see where those puzzle pieces, again, to me, just don't look like they're totally
That's before prolotherapy, and then the bottom one is after prolotherapy. And you can see that the patella in the groove of the femur, it fits nicely. So then when the person then extends and flexes their knee, whether they're running or they're just walking, they're not going to get clicking, grinding, crunching. And I don't know if you know this, but we actually did a study with 69
tell me
patients.
A little bit about this study.
69 patients, then basically with prolotherapy, 16 of the patients were told they needed surgery, like a knee replacement. Then after prolotherapy, 13 of the 16 didn't need surgery, so that's good. It kept 13 of the 16 away from surgery. But even more importantly was 96% of the patients got back to basically walking without pain, and the majority of the people got back to exercises, including running. And prolotherapy significantly decreased their stiffness.
Well, kind of explain what prolotherapy is, because again, it's a relatively new concept that I think people are just learning about. So you have a little example. It's an injection.
Yeah, this is a model of the knee. This is the kneecap. This is the patellar ligament. This is the quadriceps muscle. This is just, a syringe. There's nothing in the syringe. But prolotherapy is a natural injection technique. So in other words, for chondromalacia patella or the knee, not only do we do a natural injection therapy inside the knee, but also around the knee, so the patella then tracks correctly. So specifically, you have to do injections on the medial side of the knee to pull the kneecap in. And prolotherapy is good for not just chondromalacia patella, for most pains of the body, because most pains of the body are due to joint instability.
And what is it that you're actually injecting? I mean, when you're actually doing it, what is in the injection?
Yeah, we use natural substances. The most common substances is the normal sugar in your body called glucose or D-glucose or dextrose. And then sometimes, Carly, we'll use substances from your own body. The most common one is platelet-rich plasma, which is a component of your blood. So there is a blood draw. Then we centrifuge the blood, get the growth factors from your blood, then inject those growth factors in the painful area. And what it specifically does is it stimulates healing. So the tissue gets stronger. So instead of covering up the pain with medications or corticosteroid shots, we're actually inducing healing into the tissues.
Well, I love that you're so honest as we wrap up here, that this may not be the option for everybody, but if somebody is watching this morning and they think, you know what, I'm not ready to have surgery, I don't know what to do, I know you would suggest they learn more about prolotherapy. So what's the best way to do that?
Yeah, obviously we'd love to see them in the office in Fort Myers, Florida, but just know that, you know, we've written over 30 scientific papers. So if you go to caringmedical.com, our website, you can learn about chondromalacia and the various results we've had with prolotherapy. But it's always best to get an evaluation and see if you're a candidate for prolotherapy.
Well, again, I know people are excited to hear about prolotherapy and maybe some new options that may be able to help them with their pain. So thank you so much for being here this morning, Doctor. We look forward to having you back. And of course, for more on prolotherapy or Caring Medical Center, all you have to do is head to our website, fox4morningblend.com.
One last look at your Fox forecast, and then we'll be right back.